COVID-19 is a disease caused by a coronavirus. It is spread through droplets, which are given off by an infected person when they cough, sneeze or speak. So it's really important to make sure that you wash your hands regularly. If you are coughing or sneezing, that you cover your coughs and sneezes. And when you're out and about, to wear a face mask for additional protection.
Now, there's been a little bit of confusion about what to do and who to get help from. So the first thing that you need to know is that we are definitely open and definitely here to help you manage your health. So the first thing you need to do is book a telehealth appointment with your GP. Now, all of our initial consultations are telehealth consultations, and this has been done mostly to protect the community at a time that we're seeing more community spread from the pandemic. You'll have a telephone consult with your GP, and once and if we decide together that it's safe to bring you in and we need to bring you in, we'll invite you in for a face-to-face consult where the doctor will be wearing the full personal protective equipment, and from that point we can manage your medical health and direct you.
So there's two main options available to you. There's pop-up clinics that's been organised all over the area, and the other option is the respiratory clinics that's mostly run by GPs. For the pop-up clinics, there's two options. Some are walk-in and some are drive-through. And then there's a few pathology providers that are organising testing as well, like Dorabridge or Foresight Pathology. Usually for those you'll need a referral. But you can phone your GP, you can phone here and make a telehealth consult, and we can organise that for you. The other option is a respiratory clinic. You don't need a referral for that, but you would need an appointment, and they will do the assessment and the testing for you. That is government funded, so but they will only see you once, and if you need any follow-up, that has to be with your regular GP. So you can make a teleconsult here to speak to one of us.
Well, there's really two things that happens here. So the first thing is that you have your COVID-19 tests and your symptoms by this point have settled down, in which case you are free to resume moving through the community as per stage 3 restrictions. The second group of people though, it's a little bit more opaque. So there is a group of people that have a negative test but continue to have symptoms, and it's not clear what they can do there. So it's important to note that we can't rule out COVID-19 absolutely off the back of one test, especially if somebody is still symptomatic. So it's really important that even if you've had a negative COVID-19 test, if you still have symptoms of a runny nose, sore throat, cough or fever, that you continue to self-isolate and seek medical assistance. And that's most likely going to be via telehealth with your GP initially, and we can organise physical review if that's needed, or we can organise a second test which may be required at that time. So the take-home message is negative test doesn't always mean no COVID. If you still have symptoms, it's really important that you seek medical assistance so that we can troubleshoot with you and treat you appropriately and make sure you get the care that you need. Now, I've been reflecting on this a little bit as I sit in my consulting room alone to eat my pre-packed lunch in order to have as least possible contact with people as we can. The numbers are going up, and this is making it more likely that you or someone that you know might get the phone call to say that their result was positive. And that phone call might come from a few different sources. So it might come from the pathology lab. It might come from the respiratory clinic GP that you saw, or from your usual general practice doctor if they were the ones that ordered the test. And understandably, there'd probably be a lot of panic and fear as to what to do and where to turn to for help. The first phone call that you should make should be to your regular GP. I can't think of anybody better placed to look after you through this illness than the doctor that's known you the longest and that has all of your medical history. And during that consultation, we'll probably want to cover how to self-isolate and how to keep your family members safe. We'll talk about what symptoms you should be looking out for, and we'll do a comprehensive assessment to make sure that you're safe to stay at home. And we'll also work out a time to review you so that we make sure that we're checking in with you and family members regularly and organise to have them tested as well. So I hope it's not you. I hope it's not someone you know, but if it is, please reach out. We're here to help, and we want to get through this together.